Hi. What I will be doing for this presentation today will be the psychology of addiction for FYS class 207 at Western Oregon. What is addiction? Addiction is when a person uses a substance or engages in a behavior in which gets them a satisfying result, or a high, as some people refer to it. Which makes the person want to achieve that high or repeat that activity to get the same feeling again, despite the long-lasting consequences of the drug or the substance that can have on the person. Addiction may be stemmed from a substance such as alcohol, inhalants, opioids, cocaine, nicotine, or a behavior such as gambling. With addiction, there's evidence and research showing that addictive behavior not only can the neural connections of the brain be altered by a drug or an alcohol use and cause dependency, but the drug can also affect the size of the brain area, the amount of the brain activity, and the health of the brain cells. Addiction continues. Both substance use disorders and gambling behaviors have an increased likelihood of being associated with a mental health issue or just mental health in general, such as depression, anxiety, PTSD, trauma, or other already existing factors that you may be struggling with. The study of addiction proves that when someone gambles or uses a substance, it can affect the reward system in our brain, such as motivation, memory systems, and so on and so forth. Another aspect of addiction that is well known, and in my opinion, the most interesting aspect of the psychology of addiction from what I found, is that the individual or individuals continue to pursue the behavior despite the physical or psychological harm that the activity can cause on them. This slide is the science behind addiction. When scientists look for genes that are labeled as addiction genes. So basically what this means is what they're looking for is what can trigger someone to become addicted and what in their body or DNA itself, such as from family tree, parents, past history, and if their family, grandparents were addicted, stuff like that. And they are looking for the addiction genes, which in reality, what they're looking for are the biological differences that could show whether a person is more or less susceptible to addiction. But every person in the end responds to drugs and medications in a different way. For example, if you take medication for ADD, depression, or anxiety, which it can end up working for most people or some people, it depends on your experience. But for example, when a friend tries it for their own health problems and mental health problems, it could have a complete opposite effect and make the person feel sick. These effects can be caused by the difference in genes. Behind addiction continues. Another factor that could play into someone with drug abuse or alcohol abuse or any other substance abuse at that matter is you can also have to include environmental factors such as trauma, emotional distress, anxiety, depression, PTSD, etc. Once you consider these factors, it helps show people that there is more than just a recreational situation that it could have led to for this purpose. It can be due to stress, and it can be due to many situational issues. This slide, the effects addiction has on the brain. With addiction and the way they interfere with the brain, it can also cause neurons to send and receive and process signaling via neurotransmitters. Some drugs, such as marijuana and heroin, can activate neurons because the chemical structure mimics that natural neurotransmitter in the body. This allows the drug to attach onto and activate the neurons. Although these drugs mimic the brain's own chemicals, they don't activate neurons in the same way as a natural neurotransmitter, and they lead to abnormal messages being sent through their network. Another example of this could be with other drugs such as cocaine, It can cause neurons to release an abnormally large amount of neurotransmitters or prevent natural recycling of the brain chemicals by interfering with the transporters. Changes to the brain from addiction. Repeated exposures to an addictive substance or behavior can really cause the nerve cells in the nucleus and the prefrontal cortex, the area of the brain that involves planning and executing tasks, to communicate in a way that couples liking something with wanting it, in turn driving us to go after it. Another thing to consider when taking drugs and how it can have an effect on the brain itself, think about the pleasure principle. The brain itself can receive pleasure in many different ways, ranging from sexual, drug-induced, or even a satisfying meal. It could be as little as that. In the brain, pleasure has a distinct signature, which is the release of the neurotransmitter dopamine. For example, from nicotine and heroin, this can cause a particularly powerful surge of dopamine in the nucleus. The likelihood that of a drug on participation in a rewarding activity will lead to addiction is directly linked to the speed with which it prompts or promotes dopamine release. Even taking the same drug through different methods of administration can influence how likely it is to lead to addiction. It could be through smoking, injecting it, as opposed to swallowing it as a pill, for example. It genuinely produces a faster, stronger dopamine signal and is more likely to lead to a drug misuse. And how are addiction and the brain connected? This is a really interesting one in my opinion, along with a previous slide I have mentioned. But when you think about addiction for the first time, you really think of the psychologists and what they could be looking for and what functions of the brain can participate in the act of addiction and taking the drug and such. And for functional imaging studies, which have shown that during drug intoxication or during a craving, these frontal parts of our brains become more activated and contribute to a pattern. That includes brain circuits involving with a reward, nucleus accumbens, motivation, memory, amygdala, and hippocampus. Statistics of addiction. According to the studies that have been taking place in 2017 with a national survey on drug use and health, more than 19.7 million American adults that range from ages 12 and older struggle with drug abuse. While this number of Americans who struggle with this problem, these are the factors that can separate these numbers into categories such as alcohol abuse, drug abuse, opioid abuse, stuff like that. For example, another study that was conducted in 2017 with results showing almost 74% of adults struggling with an alcohol use disorder, and later on that year shows that 38% of adults struggling with illicit drug use disorder. In the same year both studies were conducted, they show that 1 out of every 8 adults struggle with an alcohol or drug abuse disorder. Statistics of addiction continued, but with costs. Due to the level of abuse and addiction in America, it costs more than $740 billion annually in healthcare and expenses and crime-related costs. In the year 2010, it was estimated that overall $300 billion was going into everything involving tobacco that year, while the annual total of healthcare for that year involving the drug costs were estimated to be around $168 billion. Also involving the year 2010, alcohol healthcare costs in that total year ran up to $27 billion, while in that total scheme of things, for overall the price for every factor of alcohol use came to approximately $249 billion. Treatments. Some treatments that I found were not very many, but there were some really good ones that I felt the need to put into this. There'd be counseling, medication, treatment programs that should test patients for HIV, AIDS, hepatitis B and C, tuberculosis, and other infectious disease, as well as the doctors can teach them or the patients about steps that they can take to reduce the risk of their illnesses and getting more illnesses. Counseling, like I mentioned in the first section, for seeing if there's any underlying cause of why the person could have gone into the substance abuse or behavior, such as trauma, emotional turmoil, guilt, etc. Medication, which is most effectively used when you are taking behavioral therapy, which could be for a gambling problem, it could be for other behavioral problems that could be considered an addiction. And in conclusion, addiction is a dangerous habit that can get anyone and everyone on a slippery path down into a ditch of physical and emotional helplessness that many people around us in the world go through every day. Recovery may be a tough path to take, but it is the right path to choose. Even when someone slips and relapses back into the habit, it is common and is not the end of the road for people who are trying to get better. Getting help is a process that will take long periods of time to accomplish, and starting out small and building up is the most anyone could ask for. Make sure if you know someone or have someone in your life who is struggling with a behavioral addiction or a drug or alcohol abuse addiction, please make sure, if they are getting treatment, please make sure to reassure them that it is a rough path, but with a lot of work and dedication, it can happen. And that is my presentation.